Good day to you, friends. I hope you're having a great day so far. Today, I'm going to share a little bit about my mastectomy surgery, but more, I'm going to share about the experience I had with the pain relieving medication I was given. This experience was extremely eye-opening for me, so I'm going to share it with you as well as what I learned from it, and if I were to go into surgery again, what I would do differently next time. My hope is that you can learn from my mistakes and go in with a little bit more awareness than I had at how pain relieving medications can become dangerous. Before jumping into my mastectomy experience, I want to give you a little bit of background so you can see where I was coming from. In my mid to late 20s, I became more and more aware of what I was putting in my body and how it made a difference in how I felt and how my body functioned. During that time, I started to decrease the use of medications like Tylenol, hormone medications, cough syrup, just anything that I felt was unnatural and would take my body away from its natural state. After I was diagnosed with breast cancer, it was evident that I was going to need to use medications to heal my body and to eradicate the cancer. So at that time, I had to alter my mindset yet again into thinking that medications were the healing drugs and they were going to help me live the healthiest life possible moving forward. When I was preparing for my mastectomy surgery, I remember one of the pieces of advice I got was take all the medication. So, wanting to have the best experience possible with the least amount of pain and the greatest ability to heal moving forward, I took that advice quite literally. Laying there in the recovery room, slowly coming to, I vaguely remember one of the nurses offering me some pain relieving medication, and I remember it being two different types. One was a type of morphine and one was a type of oxycodone. I don't remember which one I tried first, but I know over the course of the 12 hours there, I did try both because I remember that one of them made my body feel very antsy and very irritable. I remember during my stay there that just as the pain would start to creep back up on me and would start to become unbearable, the nurse would arrive and she would have more medication for me, which I was very thankful for. And that happened on regular intervals all through the night and into the next day when I was released. One of the things I remember quite well was my thought that these were very good medications and I was about to be released from the hospital where I had other prescription medication, but it wasn't going to be as good as the stuff she had. So I remember asking her before my next bout of pain relieving medication was due if I could have another one. And she respectfully declined, being very aware that it was not time for me to have more pain relieving medication. When she declined, I remember being a little bit upset. However, I did have my very own supply of Tylenol T3s with codeine that were prescribed from my surgeons to take every 3 to 4 hours as needed, which I did. I stayed the next day and a half in the city as I waited for my follow-up appointment with my surgeon before I was given the okay to go home. Looking back, I vaguely remember this time in the city. I remember my husband ordering some takeout food for a hotel and pretty much just laying around feeling quite drowsy and a little bit in and out. I was given the okay to head home, and we did. I remember getting home and I was still quite sore. I had to do the modifications with my bed, check out the 10 steps to get ready for mastectomy surgery. If you haven't yet, it'll be there. And I remember I had about 6-ish days left of my Tylenol T3s. and I continued to take them as prescribed on the bottle. I remember that I absolutely loved how they helped with my sleeping, as since chemotherapy, sleeping was very hard to come by. So it felt like such a luxury to be able to fall asleep, even being so uncomfortable with the tubes and the pain. I remember feeling a little bit loopy and groggy, and some of my loved ones kind of commenting on how spacey I was during that time, but I didn't really think much of it. As I began to hurt less and less in my chest area, I began to prolong the time in between the Tylenol T3s because I no longer needed them anymore. However, I did love the sleep that I was getting, so I always made sure to take one right before bed. When I only had 2 Tylenol 3s left, I knew it was time to cut back because theoretically I shouldn't need them anymore. So I decided to stop and just leave those 2 there for a just in case scenario. I transitioned to regular Tylenol and planned to take nothing at night. This is where things took a turn. I was having a very hard time sleeping to the point where I was laying awake for hours, frustrated. I could feel in my body it was very achy and restless, the feeling of almost like having growing pains, just need to move and stretch the muscles. And I almost felt itchy. I had no idea what was going on. And I just remember thinking that I just needed those Tylenol 3s to sleep. I remember thinking that I deserved having them because sleep was very important to healing. I felt myself yearning for those pills that were just sitting there waiting for me in the bottle. And I just felt hopeless and helpless. And I knew that there was a solution just sitting there waiting for me, but I also didn't want it. I didn't understand why all of a sudden my body was just so against sleep. I was laying there so frustrated, wide awake, and my body was very antsy. When I couldn't stand it anymore, I carefully rolled out of bed with my drains by my side, grabbed my phone, sat down on the floor, and typed into Google, "Is codeine addictive?" There it was, staring me right in the face. Codeine is an addictive drug. I was absolutely stunned. How could I have been so naive? It even says right on the bottle, highly addictive. And I know that I saw it. I think that I thought that it just wouldn't happen in such a short period of time. And I think that I thought it wouldn't happen to me, that I could control it. I wouldn't become addicted. But I knew right then and there that after a week of being on medication to help with my pain, my body had gotten used to it and it now craved it. Within a week, my body had become used to this incoming medication. And I knew this was the reason why I was feeling the way that I did. And I felt so foolish. How could I have done a 180, being so careful with what I put into my body, and then completely throwing that out the window, following the prescribed recommendation, but also not being fully aware of what I was doing? I continued my Google deep dive and found out that codeine is considered to be an opioid or an opiate drug, which is a word that I've heard of and something that I know to stay away from. I also found out that it is in a similar category to heroin and morphine, which are also words and drugs that I know that I wanted to stay away from. But I had no idea that codeine, along with the Tylenol 3, which is prescribed somewhat often, is in that category. It just completely blew my mind. With continued research, I found that the best way to stop a dependence is to slowly decrease the use of the medication. So with my 2 pills left, I broke them into half and staggered the use of them until they were gone. Even with my decreased use, it took about 10 days for my insomnia and my restless body to disappear and for me to be fully back to normal. This was a really big eye-opener for me. I had no idea how addictive Tylenol 3s with codeine could be. If I were to go through a surgery again that required codeine or another similar medication, I would definitely approach my use with a lot more caution. I would start small with regular Tylenol to see if that would help with the pain. If it became unbearable and I still couldn't handle it, I would increase my dosage to the Tylenol 3s, but I would break them in half first. If that wasn't strong enough, I would then increase to 1 pill and so on and so forth up to the recommended dose. But next time I wouldn't start right at the recommended dose and try to work my way down. I would start small and increase from there as needed. I want to make sure that you know that I'm not saying what I was prescribed was incorrect or unsafe, nor am I saying that you shouldn't follow your doctor's recommendations. All I'm saying is that based on my experience, that next time, if I'm prescribed medication, I am going to take baby steps and be really careful and make sure that I'm doing what's best for my specific body and its tolerance to the medication that I've learned is perhaps a little bit lower. Thank you so much for joining me here today. I truly hope that this video helps you in some way. My intent is not to try to scare you or place mistrust in your surgery care team. It was just a really big eye-opener for me and something that I was completely not aware of, so I wanted to share it with you. If you enjoyed this video today, if you found that it was helpful and informative, please hit the thumbs up. If you'd like to join me again next time for more about my breast cancer experience, hit subscribe. I wish you all the best, and we'll see you next time.